Hello and welcome to today's webinar. And very warm welcome to all of our listeners joining us today for this very special event hosted by Laureate International Universities in celebration of World Health Day. It's amazing to see listeners joining us from all over the world, including Uganda, Nigeria, Rwanda, and Texas and Minnesota in the USA. And if you're joining us from a different country around the world, then please do introduce yourself in the Q&A and let us know where in the world you're joining us from. So let me introduce myself. My name is Pearl and I'll be your moderator for today's webinar. It's worth noting that due to this busy schedule today, that we will be limited in taking questions from you. But please, I do encourage you to ask any questions that you have for our speakers in the Q&A, and we will make sure that we try and make time. And if in doubt, we will maybe try and forward on your questions to the speakers if we miss them. So I see other listeners joining us from Zimbabwe, so very welcome to you as well. So welcome, and let me tell you a little bit more about World Health Day. Now, World Health Day is held on the 7th of April every year, and this marks the founding of the World Health Organization. And it's really seen as an opportunity to draw worldwide attention to the importance of global health each year. And so over the years, World Health Day has had different themes and focuses ranging from the effects of an aging population and the contribution of high blood pressure on the burden of heart disease. So in this very special feature webinar, our guest panelists will be discussing the global issue of food safety. So now let me introduce you to our speakers today. So we are joined by two very special speakers. One is joining us from Walden University and the other from the University of Roehampton, London, online. Now, Dr. Dan Okenu is a based in the US and is contributing professor for the public health programs at Walden University, and he's also a food safety consultant. So a warm welcome to you, Daniel. Thank you for joining us. And if you could tell us a little bit about yourself and what you do as a job, but also for Walden University.
Thank you, Pearl. My name, like she said, is Dan Okenu. I'm from Nigeria, but I'm based here in the U.S. in Atlanta, Georgia, and I'm a contributing professor of public health at Walden University. I teach PhD students and mentor PhD students on their dissertations, and as well as doing a lot of consulting on food safety to industry. Before joining Walden, I've been working at the CDC, working on malaria in Tanzania. Essentially, my training, I'm a public health scientist, and my expertise is in infectious diseases, epidemiology of infectious diseases, as well as being a certified food safety management expert.
Wonderful, and you'll be telling us a little bit about the U.S. Food Safety Modernization Act and how that's going to impact the global food supply chain. So I very much look forward to hearing more about that as we go through the webinar. We're also joined by Constance Shumba, and she is an MPH faculty on the University of Roehampton London online programs. And Constance is joining us from Uganda. So welcome, Constance. If you could also tell us a little bit about yourself and what you do for the University of Roehampton, but also outside of the online programs as well as a professional, public health professional.
Well, thank you very much. I'm delighted to be a part of this webinar. I'm Constance. I'm originally from Zimbabwe, and I'm based out of Uganda. I teach with the University of Roehampton online MPH program, and I teach the intake module, which is leading and learning in the global health context. I work as a research and grant manager outside of my work in Roehampton, and I specifically work on HIV programs as well as other health conditions. In my work, and I collaborate with the Ministry of Health and other partners. My primary training is in health promotion with specialization at master's level and PhD level in international health. I work mostly sometimes as a health systems consultant, and my area of specialty is quality improvement. So basically it's my interest.
Wonderful, Constance. And you're going to be talking to us a little bit about food safety in Uganda in particular. So that will be very interesting to go from looking at the US and the global food supply chain and really looking at Uganda as a case study. And as I said to our listeners earlier on, we do very much welcome questions for our speakers today, and we will try and make time for them. But as I did say, we do have a busy schedule. So if your question doesn't get answered, then we will make sure that we try and follow up with you after the webinar. So let me introduce our first speaker. So we've already spoken to Dan Okenu, and he, as I said, will be talking about the US Food Safety Modernization Act and its impact on the global food supply chain. So let's start by looking at the kind of global burden of foodborne diseases. So Dan, can you kind of introduce us to this matter? What is the impact of foodborne diseases worldwide?
Thank you very much, Pearl. Essentially, in the world today, WHO has estimated that we have about 2.2 million people that die of foodborne and waterborne diseases annually. And most of these are essentially children. Bringing it here in the United States in particular, about 48 million people get sick of foodborne diseases annually. Of these, 128,000 are hospitalized, and about 3,000 of them die from these diseases. In terms of the economic burden, it's been estimated that almost $78 billion, dollars a year are lost, due to foodborne illnesses.
And that's incredible. I mean, the numbers that you're saying here, 2.2 million people, is a huge number of people that are affected by foodborne diseases. So it's really clear why WHO are having a focus on this year. Is it maybe a bit overdue, this focus, Dan? Before we talk a little bit about what type of foodborne diseases there are?
Essentially, WHO recognizes the importance of foodborne diseases and the impact that it's having on the world. And this is why here in the U.S. it is also receiving a lot of attention because of the statistics that I've just talked about, and again because of the economic burden. And it is really, a great, problem in terms of public health, and especially in the developing world, where the infrastructure is not yet in tune with fighting these endemic illnesses due to food and waterborne illnesses.
Yeah, absolutely. So let's talk a little bit about actually what are foodborne disease outbreaks. So what is the number one major cause of foodborne disease outbreaks worldwide?
Yeah, essentially there are so many of these foodborne diseases out there, but like you asked, the most notorious, the most common is norovirus, which is the common diarrhea disease that we get when we eat, food that are contaminated. Salmonella is a little bit common as well, having about 11%, of the total, foodborne disease outbreak. But norovirus is really the number one, with 58%, of the total disease outbreak due to foodborne illnesses around the world.
Interesting. And then what is it that actually causes this main source of norovirus outbreaks?
Yeah, there are several sources, potential sources of norovirus outbreak. And essentially, food safety, try to address these issues. The common causes include infected food handlers, who are either selling or preparing food, and even non-food workers who contaminate, a lot of the high touch point surfaces in the food service industry, or just using your bare hands, instead of using gloves when handling ready-to-eat foods. It is also possible that the food can be contaminated as such in the supply chain, and improper cleaning and disposal of body fluids. When these occur around food service establishments, there are standard operating procedures to clean them properly. When it's not done, this can lead to neurovirus outbreak. There is also some training gap, for instance, in the use of sanitizer or disinfectant in food service industry, where they don't properly sanitize or use, low concentration of these sanitizers. That can also lead to outbreak of neurovirus. Again, you have contaminated food contact surfaces or non-food contact surfaces, and the most common, improper washing of hands, by both food handlers and non-food handlers, and cross-contamination, from the restrooms, or even from the high touch points that I mentioned earlier, when the sanitizing, is not really working, and these high touch points are, contaminated by infected individuals. This can lead to neurovirus outbreak, both in the food service setting and in other areas where a lot of people come together, to share food and things like that. So it is really one of the most common, disease outbreak out there in the food service industry.
But it's interesting as well, Dan, because the things you've mentioned here, things like just simply washing your hands, these are fairly simple things, and this is something we'll look at a little bit further down the line on how actually you can, the simple measures you can put in place to stop these kind of infections, these outbreaks happening. But before we do so, let's have a little look at the other type of foodborne pathogens. So, can you explain again, what other foodborne pathogens are there other than the norovirus, and how generally people are affected by them?
Yeah, thank you very much for that question. Essentially, there are, like I mentioned earlier, there are a lot of diseases out there that are foodborne. I've listed here, some examples, including the common E. coli, and most of these, the common diseases that they cause is actually gastrointestinal diseases, which is diarrhea. And E. coli, for instance, can be gotten from, undercooked food, such as beef. That's an easy, a very common way of getting, E. coli infection if the beef is undercooked. There's also the staphylococcus. That can be gotten by, food handlers, using contaminated hands, and not using gloves, to handle ready-to-eat foods. There's also Shigella, that can be gotten from salads like potato, tuna, shrimp, macaroni, and raw vegetables, fruits and vegetables, when these are not washed very well, or they are, cross-contaminated by food handlers who are not using gloves. There's also salmonella that I mentioned earlier. Is also gastrointestinal. You can get that from cutting boards in kitchen utensils. It can also be cross-contamination from supply chain, being contaminated from source. Then you have the Klebsiella, which is also a gastrointestinal disease, and just like E. coli and Shigella, they can also be gotten from contaminated hands, by food handlers. You see, the bottom line here is, like Pearl just mentioned, washing of hands, there seems to be a common denominator for preventing a lot of these foodborne infections.
Yeah, absolutely. And actually a question that came in from one of our listeners which ties in with this discussion, and I will take it, because it asks how can we differentiate between norovirus and salmonella. So what are the differentiations? Because obviously there's a lot of, as you say, there's a lot of commonalities between these different foodborne pathogens.
Yeah, essentially, norovirus is a viral infection, and while salmonella is a bacterial infection. Norovirus is widespread. It can the incubation period is very short, and it can lead to bouts of diarrhea, and it is really the most common foodborne disease out there that you can get. While salmonella is not really as common, because it's a bacterial infection, it doesn't really develop as fast as norovirus, and it takes a lot of doing the wrong thing, before you can actually, get salmonella. But all the same, the salmonella remains a problem in most of the food service industries, where they are not doing following the protocol and doing the right thing.
Okay, thank you. And so we're going to talk about now the Food Safety Modernization Act. And actually we'd like to ask you as an audience, before we start talking to Dan about this, a poll question. So we would like to know from you if you've actually ever heard of the U.S. Food Safety Modernization Act. So this poll has gone live, and you should be able to see the question, have you heard of the U.S. Food Safety Modernization Act? And either answer, yes, I've heard of it and understand its impact, or yes, but not sure of its impact, or no, I've never heard of it. So just take a moment to answer that question. In the meantime, Dan, what is the world doing about this global issue of foodborne diseases? I mean, as we talked about at the beginning, the impact of foodborne diseases is huge, not just in terms of life, but also in terms of investment and money that it takes to deal with these diseases. So, what are people doing? What is the world doing about this global issue?
Is your question about FSMA, about what is FSMA?
Yes, yeah. So if you want to tell us about FSMA and what it's doing to help these issues.
Anyway, FSMA, like we all know, it stands for Food Safety Modernization Act. It was, signed into law, by the U.S. President early 2011, and the essence was to modernize an outdated U.S. food safety system. This is one of the latest, food safety act that has been enacted, for over 60, 70 years now, and essentially. What the FSMA is all about is a kind of radical shift from the reactive approach that is what the FDA is currently doing into a proactive science and risk-based preventive-oriented system. In other words, we don't want to wait until something happens before we try to put a corrective measure in place. We want to be proactive about it. We want to be science-based, and want it to be risk-based as well. And the most important impact actually will be that it will ensure that contaminated foods and those from unwholesome or adulterated ingredients will never get to the retailers and consumers. So in effect, a lot of protocols are being put in place to make sure that these things are addressed from a proactive standpoint.
And this is interesting because you've got these survey results, Dan, and 72% of our listeners today have never heard of the Food Modernisation Act, with 16% saying yes, but they're not sure of its impact, and 10% knowing about it and also understanding its impact. I mean, does that surprise you in terms of people not knowing about this Food Safety Modernisation Act and what it will do in terms of its global impact?
Yeah, really, it really doesn't surprise me because it is a new law around the block, and it has not taken effect. It's going to take effect early 2016. Once it takes effect, the global impact will begin to be seen around the world. Right now, the food industry here in the United States are really getting ready, towards the implementation of this law. And once it's implemented, once it becomes into force, the impact will be felt in around the world in those countries that export food to the United States. And good enough, a lot of those countries are also trying to work on their food safety laws as well in order to be ready to be in compliance so that they will continue exporting food to the United States.
And you've got actually some data that you wanted to share with us. So let me allow you to walk through some of this impact that you think will happen or that you found in terms of your research will happen once the Food Safety Modernisation Act comes into place.
Yeah, thank you very much. Let's look at in the next slide. If you look at the graph that's on the screen, you will see the amount of U.S. imports, rising over the years faster than the food exports. What it means is that U.S. is importing a lot of food, much more food than they export from around the world. And if you look at the pie chart on your right, you will see a list of countries, for instance, that have supplied organic products, to the United States in 2013. So what this is telling us is that the U.S. is importing a lot of food, from various countries around the world. It's a global village, so when there is a new law like FSMA, it's going to impact on these countries that export food into the United States. So the first thing that that I would like to point out is that the law mandates foreign supplier verification program. What does this mean? What it means is that for any food to come into the United States, the FDA is mandated to ensure that they visit the manufacturing plant and inspect on site to make sure that they're in compliance with this new law. If you don't allow FDA or if you don't comply with such a verification program, that means your food or your food export to the United States will not be allowed into the country. And again, another point is that it mandates that a preventive control food safety plan will have to be built, put in place in these manufacturing facilities. What it means is that currently we are using the regular HACCP plan. We need to change it to migrate to a more advanced hazard analysis and risk-based preventive control. Essentially, what we are saying here is that it will no longer be, waiting for a problem to happen. You have to address all issues, and make sure that you put a plan in place to be proactive about it. And this will be based on the risk, on the amount of risk, that is associated with such food products. So this has to be doing. We have to have this plan upfront, and this is applicable both for manufacturers of food here in the United States and those outside the United States that export food into the United States. On the other slide, this is a map, again showing an idea, giving us an idea of where the U.S. agricultural imports, for the year 2011 to 2013, where they come from around the world. You can see that virtually, they come from the major food manufacturers, around the world. And what that means is this law, even though it's a U.S. law, is somehow applicable to these countries since they are exporting food into the United States. So again, the law provides that you have an effective traceability and record programs. This is important in the case if there is an outbreak, for instance, and there is products coming from China and you are buying it in grocery stores here in the U.S., you will be able to trace it back to the manufacturing plant in China and be able to take them out of the food supply, out of the global supply chain, not to do harm to consumers. So they will be expected, to make sure that they have these effective traceability and record programs, and also sanitary transportation rule for human and animal foods. While you are importing these products, you will really need to ensure that you follow these rules to make sure that the foods, are not contaminated during transportation. Again, on the screen you can see, again, this is showing us how much of U.S. foods are imported. 70% of seafood, 35% of fresh food, fresh produce. What it means is that we will be interacting, the U.S. will be interacting with the rest of the world in terms of food supply, and it makes sense that that this law is put in place to ensure that the food that's coming into the United States is wholesome and of high quality without infection, without cross-contamination. So food safety record keeping and documentation is a requirement of this new law. Is expected, if you are exporting food to the U.S., you should have that in place. You should also build a solid, verifiable supply chain management program, just to be sure that these food can be traced. We can know whether they have effective food management system in place. We'll make sure to be able to see that that whatever is coming into the U.S. Is really safe and high quality. And again, if you look at it this way, while this law is a U.S. law, is actually having a direct impact on most of the countries that, most of the countries out there, because all of them do business with the United States. And because of that, the quality, the food safety management system in those countries will be improved because of this law. On the other slide, we see U.S. fresh fruit and vegetable imports by country. Again, look at all the countries that export fresh fruit and vegetables to the U.S. There is also, along with FSMA, there's a produce safety rule, that outlines the standards for growing, harvesting, packing, and holding of produce for human consumption. If your plant, your farm, whether it's in Canada or in Guatemala or in Peru, you have to be in compliance with this new rule for you to be able to export food into the United States. So it is far-reaching. What I've done here is just to give the key issues, the key provisions of the law of FSMA that will affect global food supply. It's a highly detailed document, and it affects all countries around the world, because one way or the other they export one product or many food products to the United States, and because of that they have to be in compliance to continue to maintain that trade relations with the United States. And in effect, the direct impact here is that food safety will improve, not just in the United States, but around the world, because of the impact that FISMA will have in trying to make sure that these countries will continue to do business with the United States. So I think overall is a good thing, and like I said earlier, a lot of countries are also, coming up with an update in their food safety laws, to make sure that they remain in compliance from 2016 when this law will come into effect.
Yeah, thank you, Dan. And I think this is, as you say, a really interesting law, and the impact, as you say, worldwide, because of the amount of countries that actually import into the U.S. Is huge. That, as you said, the impact will be really felt. And what's interesting is that quite a few of our listeners are based in the African continent, and there's a couple of questions asking about the fact that they don't see any African countries exporting food into the USA. One of the questions was saying, does this show quality issues? Also, another question was saying, I just missed it, but is there a reason why countries from the African continent aren't actually exporting into the USA? Do you see that changing going forward?
Yeah, thank you. Currently, there are countries, a lot of countries in Africa do export food to the United States as well. But like you rightly pointed out, the food safety system in a lot of African countries they still have a lot. And I'm very happy, that my colleague Constance will be talking about the experience in Uganda. There are a lot of improvements that are going on in the food safety system in Africa, and I can tell you, that will really increase the amount of food export, from Africa to the United States. Right now, countries in Africa, yes, they are exporting food to the United States, but the quantity, the amount will increase, with this new law and the improvement that are being put in place in food safety management system in most of African countries.
Yeah, absolutely. And as you say, we'll talk to Constance a little bit about how Uganda is increasing their food safety and the issues around that, because there's many issues around food safety and how you actually improve those things. So we'll talk to Constance about that. Before we do, though, at the beginning of the webinar, we started talking about the how things like the norovirus and salmonella actually take place, and why, and what is the reasons for these foodborne diseases. And WHO have actually given very clear instructions on how we as individuals can be safe in the home and in outside of the home. So can you talk us through the key things we can do at home to improve food safety?
Yeah, basically, the FISMA, the U.S. law is trying to put emphasis on these 5 key issues, for safer food that WHO, is championing. And these are the things that we can do both at home and in the manufacturing facilities to keep our food safe. So as simple as it may sound, washing of hands. Is you can't go wrong with washing of hands. Proper washing of hands, it can keep away a lot of these diseases, a lot of these foodborne diseases. It can also, help to prevent cross-contamination. The second point is separating raw food from cooked food. That is, it may sound very simple and easy, but this is a real problem both in the manufacturing facilities, in food service, and even at home. Because raw poultry, for instance, has a lot of pathogens on them, and if you cross-contaminate either the surface or the food, for instance, of food prep areas where you have ready-to-eat food, or even with fruits and vegetables that don't have the benefits, they do not have the benefit of being subjected to high temperature, because they are eating, as it is raw. So it's really, really important that we separate raw products, especially meat, from cooked vegetables, from cooked food. The other one is, trying to cook our food thoroughly. Essentially, you want to use thermometers to make sure that, all food are cooked at the right temperature. And where there is no thermometer, you really have to cook it. And in Nigeria, for instance, there is this saying that we actually overcook our food. The downside is, people will say maybe the proteins will be lost, the essential proteins, ingredients, nutrients will be lost. But then at the end of the day, you've achieved, that high temperature that is required to kill, any pathogen that may be there. And the other point, the last point is using safe water and safe raw materials. You may do all the things, do all the right things, but then your water is contaminated, or one of the raw materials, one of the ingredients is contaminated. That will entirely contaminate the whole food. And I want to point out here that food safety actually starts from the home, because you may buy a wholesome food, from a grocery store, and then you bring it home. The processes that you go through in the preparation process may actually contaminate the food. So it is always good to start teaching our kids right from home, wash your hands, wash your hands, wash your hands, and wash the dishes, the utensils that you are using, the forks and knives, wash them very well to avoid such cross-contamination. So these are basic issues, and these are, very well, shown in these WHO 5 key areas where we can, that we can use to make our food safer.
Great, thank you, Dan. And there's a lot of questions coming in, but in the aspect of time, we will have to move on to talk to Constance about the Ugandan case study. So thank you very much for these insights. And if I have a bit of time at the end, then I'll come back to you and ask some of the questions that our listeners have. So thank you, Dan. And Thank you. And now on to Constance, who will talk to us about food safety in Uganda. So we've talked a little bit about the global issue of food safety, and also how the U.S. Food Modernization Act will actually hopefully look at preventatory measures and more scientific based. Now let's look at Uganda as a case study. So Constance, let's start off by talking about what is the impact of food safety in Uganda.
Thank you very much, Pele. It's very exciting that we're talking about food safety today, and thank you so much, Dan, for that pace setter. Food safety is a big issue in Uganda. So Uganda is no exception at all when it comes to food safety issues. And why is it an issue? It's an issue because Uganda is an agro-based economy. So if we have food safety issues, it means as an economy, we are going to make some very huge losses. But in terms of public health, food safety is a major cause of disease. And as you see in Uganda, about 65% of all cases treated by hospitals and clinics around the country every year are diseases that are related to food safety, diseases such as hepatitis E, typhoid, and cholera. So Uganda has a huge problem in terms of food safety, but as well, the impact is felt, at national level as well as at the grassroots level. And as Dan has alluded to, food safety is a major cause of childhood illness and death, and we find that almost over 80% of childhood deaths are due to diarrhea. It occurs mostly in Asia and Africa. So Uganda is no exception, and diseases such as they've caused a big burden on the health system. So it also has economic impacts in terms of sustaining the health system in responding to such illnesses. And yet these are diseases that would likely be preventable.
So the impact of food safety in Uganda is huge. I mean, it's interesting to see that 1.3 million Ugandans a year are affected by things like intestinal worms, non-bloody diarrhea, and typhoid. And you have actually some statistics to share with us in terms of the burden of food safety in Uganda. So can you tell us a little bit more about that? And also, what's interesting as well is how important data is for you as a public health professional to understand the impact of things like food safety in Uganda.
Right. I think you really allude to something that's very important: the issue of data in the burden of food safety. So this data we are giving is really, I think, conservative estimates, given the challenges we have in the data availability. And I know this may be a challenge in many other low-income settings. So there are very high chances of underreporting in view of this. But yes, you are right. Data is a major challenge, and we can't quite say with certainty what the burden of food safety is in the country. But we know conservatively that about 65% of all cases treated food safety-related illnesses. And
do you see a focus on trying to get better data? I mean, is this something that health professionals are aware of and are pushing for, or is this something that you see will come a lot longer in the future?
Yeah, I think one of the things that we keep doing is we keep trying. We keep trying to emphasize the importance of obtaining good data for disease surveillance. Because when you don't have good data, you basically have failures in the system in terms of reliable disease surveillance. So reliable data, yes, is difficult to get, but we keep, driving this home with the health workers, with the community, report the disease so that it can be picked up. But also, the health workers should document and collect this data in a way that it can be used to target tailored strategies to respond to disease or prevent disease. So it's a challenge, but it's something that we continue to work on. And maybe, in a few years or in the near future, we will see improvement. But it's an area that we continuously work on in terms of quality improvement.
Yeah, I think what's interesting is that once you start making a conscious effort and you make people aware that how important it is, then hopefully you start moving forward and it becomes, data becomes more of a focus. So in terms of the Ugandan food chain, how is it set up, and how do you feel that, as a public health professional, do these different agencies and authorities actually work together?
Right. Yeah, as you can see, there are quite a number of agencies shown in the slide, and I'm just thinking that, is this all? In my view, there could be more sectors coming onto this drawing board. Like, for example, the Ministry of Education. It plays a critical role because this is where children are educated right from a young age to practice some of those WHO safeties that Dan has talked about. So yes, there is some effort at the national level. We have a Codex Committee, which is chaired by the Director General of the Ministry of Health. But the challenge that I see is really on the ground in practically enforcing the commitments that are made at policy level. So implementation remains a challenge. And yes, food safety is a cross-sectoral issue that requires, collaboration, but this is often weak on the ground.
Yeah, absolutely. And in terms of the kind of food safety gaps, I mean, from your perspective as a public health professional, where are the gaps in the food system? What do you think is causing this burden of disease in Uganda?
Right. I would say it's just really basic sanitation failures, and these occur in production, in processing, in storage, in transportation, retailing, and handling in homes. If you can remember the first slide that we had up, I showed there that Uganda produces over 900 million liters of milk every year. but only 10% of this is pasteurized, whilst the rest is sold unpasteurized through informal market channels. So it shows that we really have a big gap in terms of sanitation failures in food processing, production, storage, and other handling. So if we can achieve basic food hygiene, that would be great, because it's the key. But this is made really difficult by the lack of necessary sanitation infrastructure in many areas of the country and in the processing industry.
And what's interesting about Uganda and many countries around the world is the kind of the informal food market. So this is where a lot of people are doing a lot of their buying cheaper food. So what kind of role are these types of markets playing in the food sector, and what then are the issues that come from buying food on informal food markets?
Right. I think it's very interesting, because really the informal sector or the informal markets are really thriving if they can sell over, push over 90% of the milk and pasteurize. It speaks to the realities on the ground. But basically, there is no effective health and safety regulations through the informal markets. It's very hard to enforce some of these health and safety regulations, resulting in those failures that I talked about in terms of food processing right up to retail. And there are so many of them, so there are many actors. They don't pay taxes, and there's poor infrastructure, and there's little support, from the government or the NGO sector in terms of the informal food market. But customers love them because they are really cheap. They offer fresh food. People want something that's fresh from the farm, regardless of how it's been handled, because they don't know the processes that have gone in there to bring the food to the informal markets. They like the local breeds because they say they taste really good. They have trust in the vendors. And in case people don't have money, they're able to get credit. So those are some of the benefits these informal markets confer on the consumer, and that's why you find they are thriving and our preferred source of food.
Yeah, and I've just put up a picture here that you provided us with of one of these kind of food markets, and it's as you say, it's incredible because it's certainly fresh. You can definitely see the freshness of the meat there, and busy, and food is on the floor, and so there's a very visual representation of the type of what we're really talking about in terms of informal food markets. So what are the range of issues faced by consumers when buying food then?
Yeah, so consumers take into consideration a large number of issues, one of them being price. People want a good price, affordable price. They want good quantity. They want also quality. But sometimes you find that the price and quantity overrides the quality. And then there are a lot of diet and health issues that some people would take into consideration when, buying food, as well as the marketing, how well, our food stuff marketed out there, and that does influence the way consumers would buy. Yeah.
And so one particular outbreak that happened in 2013 was the issue of the pig-related diseases. So can you tell us more about this and kind of what the results of farm sampling that was carried out in 2014 and kind of the outcomes of that sampling was?
Right. Yeah, so if I can just give a bit of background on that. In Uganda, people eat a lot of pork. So consumers love their pork, but they like it well cooked and served hot. So, usually there's really a low risk of disease from eating pork. Although the risk for occupational disease is quite moderate. However, this survey, which was carried out among 1,200 households in 2013, pointed out to pig diseases such as African swine fever, brucellosis, cysticercosis, among others. And these were the diseases that were actually found among consumers eating pork. And the critical point for food safety in Uganda, especially in relation to pigs, is that, there is poor slaughter and meat handling practices. And these results often in cross-contamination from raw vegetables. So farmers, as well as the veterinarians, identified important public health threats in this survey.
And so when this came out, this food farm sampling, there was a huge thing in the media in Kampala and in Uganda. So what kind of role does the media play does it help food safety issues, or does it scare people? What does it do in terms of these kind of war on pigs? These are big headlines around this issue. So, from your perspective, what kind of role does the media play?
Right. Yeah, so these two articles were run in Uganda's Daily Monitor and another one in the Red Pepper. And one was warning that most of the pork is prepared unhygienically, which is true. It doesn't fit for human consumption. And the other one was really sensationalizing, saying we declare war on pigs, communicating that the city authority had threatened to close down all the pork joints in town. And so these pork joints are really places where people go, sit around. They're like restaurants, but people roast the pork and eat it fresh. So some of these statements running in the media are quite strong, but also trivializing. So they ask questions like, so what is contaminating the pork? What are the odds of these contaminants reaching the consumer? And what are the consequences of eating this contaminated pork? So the risk-based approach of the Safe Food, Fair Food project really aims to find answers to these questions. And eventually, when we build evidence, as was done in the other survey, we are able to communicate evidence from research instead of incomplete or these panic-stirring statements, and thus help to promote the pig sector instead of banning it. So really driving towards making food safe instead of, banning the sector totally.
Yeah, absolutely. That's exactly, this kind of fear-mongering doesn't help the people to get better and to have better provisions. And let's talk a little bit more about, in terms of the kind of role of public health professionals in making sure that they continue to promote safe and fair food. So from your perspective, what is that role?
Right, thank you so much. And I think this is the exciting bit for me, because sometimes when we concentrate so much on the challenges, it's very hard to see the light at the end of the tunnel. So I just want to emphasize through this, webinar is that, we can do something, as public health professionals in promoting safe food. And one of the things that we can do is that first and foremost, we must make food safety a priority. And once we understand the need to make it a priority, we are set to go. And the second thing is that we must take our mantle and begin to increase awareness, in our communities about, the laws and the regulations around food safety, and also invest in programs that promote food safety. So we need complementary efforts, taking on a multi-sectoral approach with all those sectors that are indicated and the ones that are not even included currently, and address these documented and undocumented sources of foodborne diseases through awareness and training. So we need to increase awareness in our communities on the effects of unhygienic food to human health and to the national socioeconomic status. Because sometimes people do things out of ignorance, and so knowledge is really power. We need to, advocate for more strict controls, because as you can imagine, we have so many good policies on paper, but implementing them in reality is a challenge, So we need to really advocate for legislation on food, and legislation that's really enforced, and enhance public participation through dialogue. And I think for me, this is really the missing link. If we can get our communities to engage with us so that they can really, become more and more informed, then they're going to start demanding for safe food. Yeah, so there are so many other, things that we can do, but we can even improve, the quality of our data, the completeness of our data. We can integrate food safety in other health programs so that, we are offering a comprehensive package to our population. I know we can spend the whole day talking about this, but I beg to.
Yeah, no, absolutely. But I think it's interesting, as you say, it's a package, isn't it? It's really looking at the full picture, and you can't just isolate it. I think that's what's really interesting about public health professionals. Is that you really can't just isolate it. Now, just before we finish up, we do have one final poll, and we are running out of time, so we will be quick with this. But one question Constance wants to know from you, the listeners, is where do you see the greatest yield in terms of food safety in low-income countries? So this poll will come up live in just a moment, and this will come up on your screen, and I will send that survey now. And so this survey will hopefully come up on your screen. Perfect. And just let us know. So what do you think is the biggest yield? So development of legislation, enforcement of regulations, and public health, public education participation. So to take a moment. Now we are running out of time, Constance, so I'm just going to jump to your final slide, which is in. I mean, we talked a little bit about the role of public health practitioners in food safety. Is there anything further that you wanted to share in terms of the impact our listeners can have on food safety?
Yeah, I think it's just for us to really recognize, you know, the impact of food safety in terms of time lost of work, the economic impact in terms of loss of productivity and revenue, the burden on the health sector, and, you know, the pain and discomfort this causes. So really aiming at prioritizing food safety and taking the mantle as as public health practitioners, and really taking that responsibility and going out into the communities and saying we must do something about food safety. We must prevent it. And there are really so many windows of opportunities out there. We just need to get hold of them.
Yeah, absolutely. And what's interesting is our listeners today are saying, you know, really 79% are saying this public education and participation is the key here. Do you agree with that?
Absolutely, absolutely. I totally agree with them.
Perfect. And we did want to end in terms of WHO's 5 keys to safe food. And if you're interested in reading more about these simple measures that you can do in your own home, then do look it up. Just Google WHO's 5 keys to safe food, and you'll be able to find more details about that. Now, I know you've had many, many questions today for us, all of you listening, and I've seen them coming through. They've been great questions, and I'd like to ask Dan and Constance if you'd be interested in maybe taking these questions offline, and maybe I can email them to you, and if you'd be happy if you could respond to some of our listeners today, would that be okay?
Absolutely, yes, please.
Wonderful, thank you both, and thank you all for listening and for this great discussion. We've had a great insight from both Dan and Constance today, so thank you both very much.
Oh, it's been a pleasure. It's been a pleasure. Mm-hmm.
And thank you to our listeners. We appreciate you taking some time out of your day. If you are interested in finding out more about the University of Roehampton London online programs or Walden University online programs, then do let us know. Let us know in the Q&A, and we will also be following up with you. We have enrollment advisors who can follow up and have a conversation with you if you're not already a student, about if you are interested in studying maybe public health with us and finding out more about how you can have, as Constance was saying, impact on the world around you. So thanks very much, and a very happy World Health Day to you all. And we look forward to either seeing you in class already or one day seeing you in class. So thanks, and bye-bye.